Okay, guys. Now we are doing the brain. Um, okay. So the deal is, first thing you want to identify the external structures before you do any cutting. Okay. And one of the important external structures will be the cranial nerves. And again, the 12 of them you're probably not going to see them, but you can sort of estimate position. Based on the diagrams that are on my heritage as well. So print yourself a copy. So here on the front here, you would see what is the remnants of the olfactory bulbs. You see, these are the olfactory bulbs. So this will be cranial nerve number 1. So if I put a pin over here, this is the cranial nerve number 1 olfactory bulb. Then here, you see the one that crosses like that. You can see that will be the optic nerve, cranial nerve number 2. Okay, the optic cranial nerve number 2. And you see this stump on the front here. Sometimes it's very prominent on some brains. Okay, that stump here is the oculomotor cranial nerve number 3. Okay, and this stump in the back here, this rather huge stump, this will be the trigeminal cranial nerve number 5. Okay, all right, and then somewhere here you might have the vestibular cochlea, the remnants of, but it's not really there. The trochlea is kind of inside here. The trochlea is inside here, which is number 4. Okay, but usually you don't see it. It's truncated. Some of the smaller nerves get truncated and they're cut off. Okay, and then you go towards the back. Here is the medulla oblongata, and it ends like right there. Okay, so the cranial nerve that's right on the last part. Yeah, this is the spinal cord starts here. Okay, that will be cranial nerve number 12. So usually I put just a pin over here on the last part. Okay, of the medulla, because medulla is the last part of the brain before you get to it tapers into the cranial nerve, into the spinal cord. Okay, you can see how it starts right there, spinal cord. So anything above here will be a cranial nerve. So this was most likely cranial nerve number 12, which is the hypoglossal cranial nerve number 12. So usually in the exam you have this olfactory cranial nerve number 1 for smell, optic cranial nerve number 2 for sight, oculomotor cranial nerve number 3 for moving muscles of the eye, those extrinsic eye muscles which I just talked about, and then trigeminal, which does a lot of things. It's got 3 branches, that are supplying the face, the teeth, the eyes as well. So trigeminal does a lot of things. So it's a very thick on trigeminal number 5. Okay, the trochlea number 4 is inside here. Usually you don't see it, and I can't even tag it in the exam. But you will see at the end, this is the sort of the rootlets of the remnants of the cranial nerve number 12, which is the hypoglossal, the last cranial nerve of the brain, number 12. Okay, and then on the top, you could see. I want you to identify these other structures there. These are on this whitish layer is the dura mater. Okay, and this here will be the falx cerebri. Okay, because it separates the 2 hemispheres. This will be the tentorium cerebelli, which separates the cerebrum from the cerebellum. And this here is the falx cerebelli, which separates the cerebellar hemispheres. Okay, so we're going to have to remove it. This is the hardest part of it. This is like a collar that holds up the cerebrum up of the cerebellum here. So that's a tough part. So we're going to make an incision to remove this. So what we make sure we make an incision like that, and then we cut off this tentorium cerebelli. Come here like that. You leave this down here, otherwise if you remove it, it comes off with cranial nerves, and you don't want to do that. Then you cut here, then you come over here, and then you just peel it off on the top. Okay, so we can see the gyri and the sulci inside. Okay, we won't be able to see the other 2 meninges because they are very intricately connected to the brain. So I'm going to cut I just have you watch the eye and then the brain, because the brain has got a lot of things for the second day. You know, once you get here, you want to really go in there and cut the 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 tentorium cerebelli, which is really the toughest part of this. Okay, so we've done the one side. We're done with the one side, and then you go again to the other side, and then you do this deal again. Put it in there. Make sure you're not damaging your brain on the bottom. Do you see how I'm using my scissors flat so that I'm not damaging my, excuse me, I'm not damaging my brain because I don't want to see cuts on your brain, okay? So there you go. Once you get here, I go back to my sharp end because this is going to be really tough, okay? And then I do that. Okay, sorry, it dropped. Okay, and then I come and cut over here too. Okay, and then it should really be not so bad when you peel it off, as long as you make sure you cut through everywhere. Okay. So here, you want to make sure that the tentorium cerebelli has been cut. Okay. Don't want it to splash on. Okay. Then you can sort of peel it off nicely like that. And you peel it off like that. And then you make sure it's cut over here nicely. Do you see how hard this is? When you guys cut through yours, you're gonna see how hard that is. So we've removed the dura mater, and there it is. Okay. Falx cerebri, okay, tentorium cerebelli. This is really hard. It almost, cradles the brain like that to, support it. Okay, so it's a good support. So there it is. We remove that, and then we see, boom, there's voila, our brain. Okay. I am gonna go and I should have gotten my oil. So what I'm gonna do is identify the other parts on the superior part of the brain. Okay, so this is the cerebral fissure or the longitudinal fissure. Okay, and the bumps are the gyri or gyrus singular, and this is the lines. Okay, so I'll put it up close. Okay, this will be the longitudinal fissure, cerebral fissure. The bumps here would be the gyri, okay, gyrus singular. The lines would be sulci plural, sulcus singular. Okay, these lines. So in the exam, I'll be specific about it. If I put a pin here and I say what's that bump, then you say the gyrus. If I put a pin here and I say what's that line, then you would say sulcus. Okay, and then we go to this cerebellum, sorry, which is the little brain, literally meaning. So this here would be, this part here is the vermis. You see, this looks like a worm. You see this, which connects the cerebral hemisphere to the other cerebellar hemisphere to the other cerebellar hemisphere. Okay, and of course this is the cerebral hemisphere, and there's the other cerebral hemisphere. Okay, vermis. When we cut through, we'll be able to see the corpus callosum, but we can't see it just like the vermis is the part that connects the cerebellar hemispheres. Okay, all right. And then I also want you to identify the lobes of the brain. So if I put a pin over here and I say, what's that lobe of the brain? You don't say gyrus or anything like that. You say frontal lobe. Okay. If I say put a pin here and I say what's that bump, then you say gyrus. Do you see what I'm saying? Okay. So this will be the. I'll be specific what I'm asking in the exam. If I put a pin anywhere here, you say frontal lobe. If I put a pin anywhere here, you say parietal lobe. If I put a pin anywhere here, you say temporal lobe. Okay, temporal lobe. And parietal lobe here, parietal lobe on that side as well. If I put a pin anywhere on the back here, you say occipital lobe.